Olanzapine is an antipsychotic drug used in the management of schizophrenia, bipolar I disorder, and agitation associated with these disorders. In this video, let's found. What is olanzapine? What class of drug is olanzapine? What is olanzapine used to treat? Who cannot use olanzapine? What are the side effects of taking olanzapine? How does olanzapine make you feel? How to use olanzapine? What is olanzapine? What class of drug is olanzapine? Olanzapine is an atypical antipsychotic primarily used to treat schizophrenia and bipolar disorder. For schizophrenia, it can be used for both new-onset disease and long-term maintenance. It is taken by mouth or by injection into a muscle. Olanzapine was patented in 1991 and approved for medical use in the United States in 1996. It is available as a generic medication. In 2020, it was the 164th most commonly prescribed medication in the United States, with 3 million prescriptions. Lilly also markets olanzapine in a fixed-dose combination with fluoxetine as olanzapine/fluoxetine, Symbyax. What is olanzapine used to treat? Olanzapine was initially used orally and intramuscularly for the chronic treatment of schizophrenia in patients over 13 years old and other psychiatric disorders such as bipolar I disorder, including mixed or manic episodes. Olanzapine is also indicated in combination with lithium or valproate for the short-term treatment of acute manic or mixed episodes associated with bipolar I disorder in adults. As well, olanzapine is indicated in combination with fluoxetine for the treatment of episodes of depression associated with bipolar disorder type 1 and treatment-resistant depression in patients 10 years old. Olanzapine is also approved for the management of psychomotor agitation associated with schizophrenia and bipolar I mania. Olanzapine is also indicated in combination with samidorphan for the treatment of bipolar I disorder, either as an adjunct to lithium or valproate or as therapy for the acute treatment of manic or mixed episodes or as maintenance therapy, and for the treatment of schizophrenia in adults. Who cannot use olanzapine? Contraindicated in patients with a known hypersensitivity to the product. May exacerbate, possibly precipitate, diabetes mellitus, low white blood cell count or liver dysfunction. Caution in galactosemia and phenylketonuria due to excipients. What are the side effects of taking olanzapine? Side effects may first appear several weeks after starting olanzapine. The most prevalent side effects for olanzapine include dizziness, feeling unsteady, or having trouble keeping your balance. Restlessness. Unusual behavior. Depression. Difficulty falling asleep or staying asleep. Weakness. Difficulty walking. Constipation. Pharmacodynamics. The effect of olanzapine in the D2 receptor is reported to produce the positive effects of this drug, such as a decrease in hallucinations, delusions, disorganized speech, disorganized thought, and disorganized behavior. On the other hand, its effect on the serotonin 5E2A receptor prevents the onset of anhedonia, flat affect, elogia, avolition, and poor attention. Based on the specific mechanism of action, olanzapine presents a higher affinity for the dopamine D2 receptor when compared to the rest of the dopamine receptor isotypes. This characteristic significantly reduces the presence of side effects. The effect of olanzapine on dopamine and serotonin receptors has been suggested to reduce chemotherapy-induced nausea and vomiting, as those receptors are suggested to be involved in this process. For this effect, several clinical trials have been conducted, and it has been shown that olanzapine can produce a significant increase in total control of nausea and vomiting. How does olanzapine work? The activity of olanzapine is achieved by the antagonism of multiple neuronal receptors, including the dopamine receptor D1, D2, D3, and D4 in the brain, the serotonin receptors 5-HT2A, 5-HT2C, 5-HT3, and 5-HT6, the alpha-1 adrenergic receptor, the histamine receptor H1, and multiple muscarinic receptors. As above mentioned, olanzapine presents a wide profile of targets. However, its antagonistic effect towards the dopamine D2 receptor in the mesolimbic pathway is key, as it blocks dopamine from having a potential action at the postsynaptic receptor. The binding of olanzapine to the dopamine D2 receptors is easily dissociable, and hence, it allows for a certain degree of dopamine neurotransmission. On the other hand, olanzapine acts in the serotonin 5-HT2A receptor's frontal cortex in a similar manner than the reported on dopamine D2 receptors. This determined effect allows for a decrease in adverse effects. Half-life. Olanzapine presents a half-life ranging between 21 to 54 hours, with an average half-life of 30 hours. How to use olanzapine. Schizophrenia. Pa. 5 to 10 mg/day initially, if necessary, may be titrated upward in increments of 5 mg per day at intervals 1 week. Maintenance, 10 to 20 mg/day, not to exceed 20 mg per day. Recommended IM, extended release dose, based on oral dosage. Oral dosage, 10 mg per day, 210 mg IM every 2 weeks or 405 mg IM every 4 weeks for August 1st weeks, then 150 mg every 2 weeks or 300 mg 4 weeks. Oral dosage 15 mg per day, 300 mg IM every 2 weeks for August 1st weeks, then 210 mg every 2 weeks or 405 mg every 4 weeks. Oral dosage 20 mg per day, 300 mg IM every 2 weeks for August 1st weeks, then 300 mg every 2 weeks. Bipolar mania. Indicated for acute/maintenance treatment of manic or mixed episodes associated with bipolar I disorder, may be used adjunctively to valproate or lithium in the treatment of manic or mixed episodes associated with bipolar disorder. Monotherapy, 10 to 15 mg/day PO initially, may be titrated upward in increments of 5 mg per day at intervals greater than 24 hours adjunct to lithium or valproate, 10 mg per day PO initially. Maintenance, 5 to 20 mg/day PO, not to exceed 20 mg per day. Agitation associated with schizophrenia and bipolar I mania. IM, short-acting, February 5th, 10 mg/dose. Additional doses, up to 10 mg, may be considered. Administer subsequent doses 2 hours after initial dose and 4 hours after second dose if necessary, not to exceed 30 mg per day. Bipolar depression. Indicated for depressive episodes associated with bipolar I disorder in combination with fluoxetine. 5 mg PO in evening, adjusted to range of 5 to 12.5 mg/day. Safety of co-administered doses greater than olanzapine 18 mg with fluoxetine 75 mg have not been evaluated. Chemotherapy-associated nausea or vomiting, off-label. Off-label use for prevention of chemotherapy-associated nausea or vomiting in combination with 5-HT3 antagonist and dexamethasone. For nausea and vomiting, 5 to 10 mg PO QD for 3 days, when not used for acute and delayed emesis prevention. Are there specific concerns about olanzapine and pregnancy? US FDA Pregnancy Category C. Animal reproduction studies have shown an adverse effect on the fetus, and there are no adequate and well-controlled studies in humans. But potential benefits may warrant use of the drug in pregnant women, despite potential risks. That's all the information about olanzapine we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.